Hi, I'm Marty Nimko. I'm going to talk to you about 5 COVID ethical questions, hopefully toward more psychological comfort and more nuanced decision making. Important ethical issues do exist in the COVID pandemic. They have implications for our psychological as well as our physical health, and here are thoughts on 5 key such issues. First, how much should be made public regarding the vaccine? We endlessly hear bumper stickers and sound bites. The vaccine is 90% effective. The vaccine is 94.5% effective. But informed consent demands much more nuance. For example, Moderna's December 17, 2020 report to the FDA on its vaccine admits that it still doesn't know length of immunity, the extent to which it prevents transmission, nor intermediate, let alone long-term side effects. You might check that out, page 48 plus, 48 through, 50-something has that. Just Google Moderna's report, FDA, December 17th. Anyway, why is that important? Because many drugs have been pulled off the market because of serious safety issues that were found a year or longer after the drug was made available to the public. As the public decides if and when to take the vaccine, does not the media, which is the primary basis on which the public is deciding, have the obligation to tell what important facts are known, are not known, and when higher quality information will be available? Now that said, an argument can be made to restrict such information. From a utilitarian perspective, it appears that the more people that get vaccinated, the greater the net benefit to society. Sure, a small percentage of individuals may fare poorly, but Marx and purist utilitarians would argue that the goal should be the greatest good for the greatest number. But back on the other hand, is not sunlight the best disinfectant? Without overwhelming the public with so much information that it's counterproductive, providing full disclosure is likely to yield both the best individual decisions and increased trust in the media and in science, which long-term will yield the most societal benefit. The second ethical issue is who should have priority in receiving a vaccine? Well, it seems clear that first responders should be first to get the vaccine. Controversy arises, though, as to whether the elderly should be next in line. Yes, old people are more vulnerable to hospitalization and to dying from COVID, but they have fewer years left to live, and prolonging their life with the vaccine on average means they'll die of more protracted diseases, tormenting not only themselves, but their family and the already overwhelmed healthcare system. With children and young adults rarely getting serious COVID disease, might it be most ethical for people, say, between 40 and 60 to be second in priority? Now, on the other hand, here's a differing thought. Given how much still is not known, as I've just mentioned, an ethical case could be made for deferring mass vaccination until the summer, by which time we will know much more because more months will have transpired since the trial patients were vaccinated. That'll enable scientists to assess intermediate-term effects, effectiveness and side effects, and the vaccine's ability to prevent transmission. So rather than encouraging everyone to get vaccinated as soon as possible, might it be wiser for the public to wait until the summer, and meanwhile to do the no side effect preventative, that is, the usual social distancing, hand washing, and so on? By summer, the decision whether to take the vaccine will be, I think it's hard to say it would be more fully informed. The third ethical issue is, have we fully enough disclosed the probability and consequences of false positives and false negatives in the test? Last week, the New York Times reported, quote, if a person recently started feeling sick with COVID-like symptoms or interacted with someone infected, there is already good reason to suspect the virus is present. People in this category who test positive can usually be pretty confident in a positive result. Healthy people with no known exposures who live where the virus is scarce are pretty unlikely to test positive. In regions where coronavirus cases are rare, false positives could outnumber true positives, a situation that could cause undue harm and erode trust in testing. These errors will also go up when a less accurate test, like an antigen test, is used. Most often when you're going to your CVS or whatever, they're using what's called a PCR test. The antigen test is used for the mass testing that are self-testing, stuff that you'll be able to, if you haven't already, be able to just get and test yourself. and see the result. Anyway, an antigen test. You're most likely going to be getting a PCR test. Anyway, before urging mass testing of asymptomatic people, do we not have an ethical obligation to publicize what I've just talked about? Even more nuanced, but important, to use the unintellectual, not probabilistic term, in an abundance of caution, the test routinely used, which is called a PCR, the results are typically deemed positive if 35 or even 40 rotations of the sample are required to detect a measurable amount of virus. In fact, an article in ICD-10 Monitor, that's a publication for infectious disease specialists, indicates that unless the results require fewer than 25 or even 20 rotations, not 35 or 40, it's likely to be a false positive, signifying such a small presence of virus that significant illness or transmission are too unlikely to justify quarantining the person for 10 plus days and creating undue worry not only in that person who tested, quote, positive, but many other people, because the positive person is required to inform everybody that he or she's been in contact with. On the other hand, COVID is continuing to spread at an alarming rate, including a new, more infectious variant. Despite the aforementioned liabilities of the tests, might mass testing be worth it if it might slow the ever-spreading disease? The next ethical issue regards tracers. The U.S. has hired more than 71,000 people to trace people who have tested positive. How likely is that effort to improve humankind relative to the costs? Well, a few states are scaling back contact tracing, and that's because many people are unwilling to talk with the tracer. Those that do may forget a significant percentage of their contacts, and even when they can remember, they're often unwilling to disclose those people's names and contact information, knowing that they'll be required to quarantine for at least 10 days. And of course, a significant percentage of a person's contacts are unknown. For example, everyone in the supermarket and other stores at which they've shopped, and everyone at gatherings they attended. Could that, if you're positive, chances are you've lived with or attended gatherings with lots of people. Could the taxpayer dollars be better used? On the other hand, tracers provide some benefit, and we need all the help we can get. Plus, 71,000 people have gotten a job in a time when jobs are scarce. The next ethical question is, how granular should incidence reporting be? Until recently, my county's public health website enabled the public to learn the percentage of each zip code's population that tested positive, was hospitalized, and who died. That was reassuring to me. There were very few positive COVID tests and almost no hospitalizations. Some other zip codes in my county showed rates that are 10 times higher. As you and I assess our risk and our resulting behavioral decisions, shouldn't we have access to the most relevant level data? For example, by zip code, and ideally by zip code disaggregated by age? Alas, now that website's been closed to the public, apparently. It does require a password, which seems to be obtainable only by public health professionals and the media. Does that media have an ethical obligation to post data by zip code, disaggregated by age, ideally? Yet the media mainly reports national, sometimes state, and at best county-level averages, which, per what I mentioned just a few minutes ago, provides little value as in our making COVID prevention decisions, such as whether to risk going to the supermarket or the conditions under which it would be acceptable to get together for coffee with a friend. Of course, incidence per zip code has profound implications for how much to shut down a locale. Is it ethical to shut down an entire county, let alone most of a state, when the risk varies so widely by zip code? For example, in my state, California, most of the state has been ordered into lockdown. They say, stay home, except for the essential, no gatherings of any size, and all restaurants are closed, even to outdoor eating. So millions of people in low-risk zip codes are unnecessarily locked into their homes, with the attendant human suffering, including job loss, increased domestic abuse, substance abuse, and just plain cabin fever from having to live such a restricted life for so long. Countless businesses are forced to terminate employees or go out of business. In low-risk zip codes, all of this suffering for such limited benefit. The takeaway? We can gain an additional measure of psychological comfort and make more nuanced decisions regarding the pandemic if we gain clarity on what we want to do and what we believe regarding COVID. I am hoping that the foregoing thoughts will encourage you to gain some of that clarity. In any event, I do thank you for watching. I'm Marty Nemko. I welcome your thumbs up and accept your thumbs down. I always look forward to your comments, and I especially like it if you hit the share button below, share on your social media so that my efforts can have broader impact. And I am flattered if you choose to subscribe to my channel. And in any event, I do thank you for watching. I am Marty Nemko.